I think there's lots of opportunities. There's certainly lots of professional opportunities to really grow within your specialty. I've been able to practice a broad variety of things within general surgery that you probably wouldn't have the opportunity to elsewhere, and that's really been something that I found very attractive. Other opportunities exist at Altru to participate in leadership, and that's something that I've noticed is pretty unique to Altru, in that anybody who has interest in that certainly has the ability to participate in to the degree that they're comfortable, and that's just something that you don't see in a lot of other systems.
After experiencing what was going on with the people, how nice they were, the organization in general, the support staff, working with them, and everybody seemed to be very friendly and easy to get along with. So that was probably my biggest reason initially deciding to come to Altru.
The fact that the hospital and the clinic are so close daily plays an important part in our practice, because literally you can be in the office and then 3.5 minutes later you can be at the bedside of a patient in labor and delivery.
It's been very convenient actually being next to the hospital. Also, it's very convenient to run over for the noon conferences, the educational conferences that we have, or for meetings that you may have. You find that you don't have to book out extra time to get to the hospital. It's just right there, so it makes it very, very convenient.
Most of the physicians, if not all of the physicians on staff at Altru Health System, have teaching appointments at the University of North Dakota School of Medicine.
I think the fact that Altru is a teaching hospital, it keeps us young, it keeps us current, and it keeps us informed, and it keeps us motivated. It also lets you pass on the attributes of caring and compassion that are so important in medicine.
The Physician Compact has been designed by physicians, and it's for physicians in the health system. It's an agreement between ourselves as individual physicians and all of our partners, as well as all of our other co-workers. What it does is it outlines exactly what we as a healthcare system expect from physicians, but it also outlines what we as physicians can expect in return from the healthcare system. It guarantees that we will have a physician-led organization in which, as physicians, we have a major say in what the organization is doing and where it's going. It assures that we will receive the up-to-date technology and services that we need to provide the best care that we can for our patients.
I guess if anybody wanting to join Altru to ask me what I would think, I guess I would strongly encourage them to do so. I've had the opportunity to work in the area as part of Altru, and prior to that in a smaller group practice, and I think that my professional life has been much more rewarding as part of Altru. It's a physician-led organization and is very responsive to our needs. There's a great degree of openness between administration and physicians, and I think that at no point are you ever going to be treated like a number. And I think that that really means a lot to most physicians. I know it certainly does to me.
I like working for Altru. Probably the most important is the strength of the organization, collegial get-together of the individuals, knowing who the other players are, how we interact, and probably that gets to the core of the organization, which is the mission statement that we are here for the patients, what delivers the best care. And one way to explain that is look at the other model, which is bottom line driven. Here our whole system is developed and being developed to put the patient first, get the information we need, and get the support staff so that we can take the best care of the patient and feel comfortable that what's within our capabilities is as good as any place in the country.